Hello and welcome. Today, we're diving deep into a complex and often overlooked complication of malaria-associated nephropathy, or MNN. This condition affects the kidneys and can have serious consequences, especially for children living in malaria-endemic regions. We'll explore what causes MNN, how it develops, its symptoms, and how we can combat it. Malaria-associated nephropathy isn't caused by the malaria parasite itself directly attacking the kidneys. Instead, it's generally believed to arise as a consequence of the immune system's response to the parasite. Specifically, certain strains of Plasmodium malaria are strongly linked to the development of chronic kidney disease in children. While Plasmodium falciparum, the most virulent malaria parasite, can also cause acute kidney injury, its association with chronic MNN is less frequent than P. malaria. The pathophysiology of MNN is complex and involves several interacting mechanisms. Chronic parasitic infection leads to the formation of immune complexes, combinations of antigens and antibodies, which circulate in the bloodstream. These complexes deposit within the kidney's glomeruli, the tiny filtering units responsible for cleaning the blood. This deposition triggers inflammation and damage, leading to glomerulonephritis. Complement activation, part of the innate immune system, further amplifies the inflammatory response, contributing to kidney damage and scarring. Over time, this progressive glomerular injury leads to proteinuria, the presence of excessive protein in the urine, and ultimately, kidney failure. Malaria-associated nephropathy is primarily observed in regions where malaria is endemic, particularly in sub-Saharan Africa, South America, and parts of Southeast Asia. The prevalence is difficult to determine precisely, as MNN often goes undiagnosed, especially in resource-limited settings. Children, especially those between the ages of 5 and 15, are disproportionately affected, likely due to repeated malaria infections during childhood, a time when their immune systems are still developing and vulnerable to long-term consequences of chronic inflammation. The signs and symptoms of malaria-associated nephropathy can be subtle initially, often developing gradually over time. Key indicators include proteinuria, detectable through urine testing, swelling or edema, particularly in the legs, ankles, and around the eyes, may occur as the kidneys lose their ability to regulate fluid balance. High blood pressure or hypertension is another common finding. Over time, as kidney function declines, patients may experience fatigue, loss of appetite, nausea, and vomiting, ultimately progressing to signs of chronic kidney disease. Diagnosing malaria-associated nephropathy requires a comprehensive approach. Urine analysis is crucial to detect proteinuria. Blood tests are essential to assess kidney function, measuring creatinine and blood urea nitrogen sub-UN levels. Microscopic examination of the urine sediment can reveal red blood cells and casts, indicators of kidney inflammation. In some cases, a kidney biopsy may be necessary to confirm the diagnosis and assess the extent of glomerular damage. It is important to rule out other potential causes of kidney disease, such as other infections or autoimmune conditions. While there isn't a formal classification system for MNN in the same way as for other types of glomerulonephritis, the severity of the condition can be categorized based on the degree of proteinuria, kidney function, and the presence of complications. Patients may be classified as having mild, moderate, or severe disease depending on these factors. Furthermore, the histopathological findings from kidney biopsies can provide detailed information about the type and extent of glomerular damage, which can guide treatment decisions. The treatment and management of malaria-associated nephropathy is complex and focuses on controlling malaria infections, managing symptoms, and slowing the progression of kidney disease. Regular treatment and prophylaxis to prevent malaria infections are essential. Medications such as angiotensin-converting enzyme inhibitors (AC inhibitors) or angiotensin receptor blockers and ARBs are often prescribed to reduce proteinuria and control blood pressure. Diuretics can help manage edema. In advanced cases, dialysis or kidney transplantation may be necessary to maintain life. Immunosuppressive therapies, such as corticosteroids, may be considered in some cases to reduce inflammation, but their use is controversial due to the risk of increased susceptibility to infections. Nutritional support is also important to maintain overall health. Prevention is the most effective strategy against malaria-associated nephropathy. Controlling malaria transmission through vector control measures, such as insecticide, treated bed nets, and indoor residual spraying, is crucial. Prompt diagnosis and treatment of malaria infections are essential to prevent the development of chronic complications. Public health initiatives that focus on improving access to healthcare and educating communities about malaria prevention and control are vital in reducing the burden of MNN. The prognosis for patients with malaria-associated nephropathy varies depending on the severity of the condition and the availability of treatment. Early diagnosis and prompt treatment can help slow the progression of kidney disease and improve outcomes. However, in many cases, men can lead to chronic kidney disease and ultimately kidney failure. Recent research is focused on understanding the specific mechanisms underlying the pathogenesis of men, identifying biomarkers for early detection, and developing more effective treatment strategies. Studies are also investigating the potential role of vaccines and immunomodulatory therapies in preventing or treating men. Further research is needed to improve our understanding of this complex condition and develop interventions that can reduce its impact on affected populations.